Hi, my name is Kim. I am from WeSpeakStudent, and I'm here to talk to you about your health insurance plan today. And just a reminder that this is for international students. So if there are any domestic students on right now, I think this will be a lot of information that is kind of redundant to you. So you could tune in tomorrow for the domestic um, plan webinar because today we are talking to international students. I did see Yukiko, who is from the SA, was on with us today. Hi, Yukiko, good to see you. But I think I'm just going to get right into it and we will get started. If you do have any questions, please feel free to write them in the chat. It goes directly to me privately, so you don't have to worry about it going to anyone else. I do want to set expectations today that I'm not able to answer specific questions about your coverage dates or any claims that you've submitted. Anything that is individual to you, you can reach out to our call center after our webinar today, and then they'll be able to help you with that. But any generic questions, happy to help you out, and let's get started. So today, I think if you take one thing from the day, I just want you to know that there are so many ways that you can get help. Rather than having a PowerPoint presentation or anything along those lines, I actually prefer to just go through the website with you, which is what I'm going to do. So I'm going to share my screen now, and we're going to go through the website. Keep in mind, this is all live. I'm actually just going to turn off my email. Sorry, guys. It's very distracting. All right, they're off. So WeSpeakStudent.com is your, place to go for international insurance information. It's going to show you how you submit claims. It's going to show you, what your coverage is, what you have available to you. So I'm going to go through that for you today. Of course, if you have questions, you can always reach out to the SA, to our call center. But there is a lot of resources available for you to access on your own time as well. So we're going to go to George Brown College, and it will bring you here. I know that it looks like there's a lot of stuff, and that is because there's lots of information that is available to you. So I'm going to try to go through it as best possible today. Again, if you do have specific questions about coverage and I don't go in depth, please ask at the end. But I imagine I will probably go through a lot of your questions within the next, 20 to 30 minutes. So if you wouldn't mind holding off on your questions until the end of the presentation, that would be much appreciated. So as I said, we do have a call center. You'll see the number right here, as well as a live chat. So I'm just going to start out by saying, like I said, there's lots of places for you to get help. Of course, the SA, but we are here to help you every day from 7 a.m. to midnight. So you can start a chat. I promise it is a real person on the other end. It is not a chatbot. So that's available for you to ask your questions, and all you got to do is put in your email and then you start the chat. Or of course you can give them a call or email at help@morecare.ca or help@WeSpeakStudent.com. All right, so as I said, we are going through the international student coverage today. Please note that there are actually two different international student coverages. So today I'm going to go through the international student post-secondary plan. That would be if you are a full-time student in a full course load for the entire year. There is also the International Students Canada ESL plan. That would be if you are in an ESL 2-month program. So I'm going to focus on this international post-secondary plan today, but I will also make note, and I guess I can just show you right now, if you are on an ESL plan, you have the same coverage as the international students, but you don't have the health and dental portion. So there is the international OHIP, which I'll go through, accident benefits, which I'll go through, and travel benefits, which I'll go through. But if you are an ESL student, please remember you do not have the health and dental portion that I will be going through as well. All right, so as you can see too, there are specific different areas for you to go to. And it's important to make sure that you're going to whatever program is reflective of you. So in this case, we are going through post-secondary plan, and we're going to click on right there. All right, so we're just going to go right through. Again, apologies if I'm going through too fast, but I think it's just better to do a quick overview. This information is always available for you to go through, and then we can just answer some questions at the end. So your international OHIP alternative. if we were in person, I would say, who here has ever heard of the term OHIP before? And maybe someone would raise their hand, maybe not. But the term OHIP stands for Ontario Health Insurance Plan. That is what me and any other Ontario resident has in place for our healthcare coverage. Now, of course, you are international students that have come to Canada to study at George Brown, and we have created an OHIP alternative for you so that you can have very, very similar coverage to all of the Ontario residents here as well. So the OHIP alternative coverage, this is when you're going to, a doctor, a hospital, if you need blood tests, if you need, lab results, x-rays, that kind of stuff. So I do like to say it is your, most important coverage. This is coverage that is unique to international students at George Brown. So this would be what you would need to bring your MoreCare card with you to the, hospital or the doctor's office, which I'll show you in a second, but I'll read through this coverage real quick. So you'll see here that there's $1 million lifetime benefit maximum. It's for going to treatment of illness or surgery in a doctor's visits or in clinics, as well as hospitals. Various medical devices are covered. And there's other coverage as well that I do want to mention too. But ultimately, you have $1 million to go to the doctor while you are a student at George Brown. Now, there are some maximum within that $1 million, and those are included here at the bottom. So you do have maternity coverage. So if you were to find yourself pregnant while you are a student here at George Brown, you do have coverage up to $25,000. Keep in mind that that is a high coverage amount. So there are many students that do have, children on that coverage for them. So just letting you know that is a great amount of money towards maternity coverage, but there is a $25,000 maximum. Psychiatric hospitalization, there's a $25,000 maximum. Self-inflicted injuries is $10,000 maximum. Oncology treatment, which is cancer treatments, is $25,000 maximum. And then repatriation and return home are both individually $10,000 maximums. So return home, it always sounds exciting. Ooh, I have $10,000. I miss my mom. I'm going to go fly home to go see her. As wonderful as that would be, unfortunately, that is not what it means. What return home means is if you get so severely ill that you are unable to continue, treatments that you need here in Ontario, then there is $10,000 to make sure that you get home safely, where you can get your health coverage where in your home country. All right, so I'm going to continue on. So next we have prescription drugs. You're going to notice that there are 4 different plans that you can choose from for within these, next health and dental coverages that I'm going to show you. Unfortunately, the deadline to change those flex plans has changed. So if you did not change your plan prior, everybody was automatically put on the balanced plan. It is all, balanced, if you will. So there really should be no issues there. You have a good amount of coverage for all areas. I'm not going to read through all of the other coverages, but please take a read through if you'd like. And if you did change your plan, then that is what your coverage would be for those enhanced plans. All right, so the balanced plan. So for prescription drugs, that means any, drugs and medicines that are prescribed by a doctor. There is a $5,000 maximum. It is 90% covered, and there is an $8 dispensing fee cap. Now it's 90% covered for oral contraceptions, and then 80% covered for all other eligible medications. Most drugs are covered. Allergy serums, insulin supplies, as well as Gardasil vaccines. If you do have any questions, you're not really sure if a drug would be covered, you can also reach out to our call center and they can let you know. If you do have a prescription that you have back home and you're looking to get that filled here, just letting you know that you will have to see an Ontario physician first, because you won't be able to fill an international prescription at a pharmacy. So all you need to do is go to a doctor, say, I've had prescription ABC in my home country and I'd like an equivalent here, and they'll be able to give you an Ontario equivalent, no problem. With prescription drugs, what's really great is you will bring your student medical card to the pharmacy. They'll be able to take the information, put the claim through right away, and then you're not going to have to pay out of pocket for what would have been covered. So you would just have to pay that 20% out of pocket, which would be, if it was $100 drug claim, then we would pay 80% and you would have to pay the 20%, which would be $20 out of pocket. All right, moving on to dental. So you do have dental coverage as well. There's a $750 maximum. 80% is covered of one examination, as well as 80% of one cleaning, which is up to 2 units of polishing and scaling, I should say. So just a fun fact, 1 unit of scaling is equal to 15 minutes of cleaning. So that would mean 30 minutes of cleaning within the policy year. It's important to note that your policy year runs from September 1st, 2020 to August 31st, 2021. So for all of the full-time post-secondary students, that is your coverage dates, and you would have started September 1st and again go till August 31st. And these numbers would go back to 0 if you were to continue next year. Minor restorative is covered at 75%, as well as extractions, neurosurgery. And then there are other areas covered. So endodontics and periodontics are covered at 50%. And then major restorative is covered at 15%. I do recommend with dental offices, always request getting a quote before. Same as prescription drugs, you can bring your student medical card with you to the dental office, and they'll be able to put the claim through for you. So you're not going to have to pay out of pocket what would have been submitted by the insurance, which is great. But you are able to get a quote so that you know exactly how much you will have to pay out of pocket. So there are no surprises when it gets to the end and you're good. All right, extended health. So this has been the balance plan. I'm just going to keep everybody muted for now. Sorry, guys. And then at the end we can totally chat. Okay. All right. So the extended health plan. So the balance plan. All benefits are covered at 80%. So paramedical practitioners, they're all covered at 80%, up to $25 per treatment, and then up to $300 per policy year. So that means you can go and get $25 covered per treatment, up to $300 for each policy year. So you'll see that you can get services of a chiropractor, naturopath, podiatrist, osteopath, physiotherapist, speech therapist, and massage therapist. I do want to mention that it is important that if you do go see a massage therapist, it does need to be recommended by a physician. So you do have to have a physician's referral, which would have had to come before your massage appointment. You also have 80% covered up to $1,000 for services of a clinical psychologist or psychotherapist. There is coverage for orthopedic supplies, which is great. You guys can give this a read on your own time too. We'll be here forever if I read it all. So ambulance is covered at 80%. It's important to know that ambulance is different than your OHIP coverage. That goes the same for me. Ambulance always comes out of pocket. So it would cost around, $250 to $290, which would be 80% covered, and the rest would be out of pocket. So if you are able to get yourself to a hospital, in a different way than an ambulance, I highly recommend it, just so that the ambulances are saved for students, or not just students, just people in need. Equipment rental is covered, medical supplies, as well as prosthetic appliances, hearing care, and many other things. So if you have any questions about the extended health, if you have something specific, if you do have a prosthetic appliance or you do need hearing aids, reach out to our call center on your specific case and they can let you know. All right, vision. So you have vision coverage as well. The only difference to the entire plan in regards to policy dates is the vision coverage. So while everything else goes back to 0 on August 31st, 2021, vision is every 24 months, so every 2 years. So you do have 100% of an eye exam of up to $65 covered, as well as $100 for prescribed lenses or frames. So if you were to go and get your eyes checked today, October 27, 2020, you would not be eligible under the George Brown WeSpeakStudent More Care Plan until October 22nd, 2022. Awesome. I do see some questions popping up, guys. I'm just going to get to the questions at the end. I do appreciate your understanding in this. I just want to make sure that I go through everything first, and then we'll answer any questions at the end. So if you wouldn't mind holding your questions, that would be awesome. All right, accident benefits. So these aren't fun to talk about, but I think they're really important to make sure that everybody knows about. I always recommend to students, let those close to you know that you have this coverage as well. Just so if something, hopefully it does not happen, but if something were to happen, everybody knows exactly what coverage is available to you. So you have $1 million maximum for any one accident. So there's loss of life included. There is accidental medical reimbursements. There's accidental dental coverage. So there's lots of different coverages here. I just want to make sure everybody understands that this is for accident benefits, and The difference between an accident and a non-accident, so a heart attack, that would not be an accident. Getting hit by a car, that would be an accident. So if you were or have or are, I should say, a part of an accident, make sure that when you fill in your claim forms, you do check off that it is part of an accident, because then there's additional coverage available to you. All right. And last but not least, travel. In an ideal world, we would all be traveling right now, and I wish that we were, but that is not the case. That being said, you do still have travel coverage. And I want to finish reading all of these coverages to you with the note that there are no exclusions for COVID-19. I know that's the typical elephant in the room these days. So for your OHIP alternative coverage, as well as your travel coverage, there are absolutely no exclusions for COVID-19. As long as you're following the government, recommended protocols for essential versus non-essential travel to various countries, then your coverage is absolutely as is, and there's no exclusions. So you'll see here for travel that you do have a lifetime maximum of $5 million for trip durations up to 120 days. It's important to know that this is actually for anytime you are outside of Ontario. So if anybody is living outside of Ontario, this would be the coverage that is available to you, with the exception of your home country. So no coverage is available to you if you are studying in your home country. If you're studying in Ontario, then your OHIP alternative would be available. If you're studying outside of Ontario, travel coverage would be available, but that's only for 120 days. All right, so that is all the information that I have for you on your coverage. You're going to notice here that there is some more information available too. So I'm going to kind of click through it really quickly, and then we'll get to your questions really soon. So you're going to see here that there is COVID-19 update. This is the MoreCare update. MoreCare is the international start of the plan, or I should say the international part of the plan. So there is a frequently asked questions section here. So can I receive COVID-19 testing? That's a very common one. The answer is yes. And this is information on where you can go get assessed. Of course, this is constantly changing information, so we do update it as much as we can with the government changes. So if you scroll down, is my coverage affected by COVID-19? Short answer, no. There's lots of information that is available for you here. So if you have any, COVID-19 related inquiries, check out our frequently asked questions page. And if you are unable to find an answer there, then reach out to us and we'll be able to help that way. All right, so let's go back to our, there we go. So that's information on COVID-19. So this is information on how to email your claims. Really easy. It's claims@morecare.ca. So I know it's kind of confusing sometimes seeing WeSpeakStudent and MoreCare. WeSpeakStudent is the overall insurance company that is providing insurance for all students at George Brown. But MoreCare is the international specific coverage, which is the OHIP alternative that allows you to go to the hospital, the doctor's office, in those type of areas. So that's why it's claims@morecare.ca. But this information is also on the claim form, so you won't be able to miss it. All right, so let's click on right here. Now, this is the Your Space page. If you notice, I went through the international post-secondary box to this information. It's important to know that this information is different than what a domestic student would see. So you need to make sure that you're always going through the international post-secondary portion of the plan. So you're going to see here that there are various booklets as well as forms. So if you want to, read up into in-depth detail of your insurance plan, the booklet is available there for you. What I went through with you today is just a brief summary. There is about 60 pages available for you here. So if you want to give that a go, feel free. So then there's also the travel booklet, which is information. We have the travel benefits card here, as well as the travel benefits booklet. Finally, forms. So there's an instruction form for the claim forms. This is a great place to go. I'm not going to go through the forms in too much detail for you today. They're pretty self-explanatory, but if you have any questions about a specific type of claim, please do read through this little helpful guide. That'll be a huge help for you when submitting your claims. So I'm going to click on the claim form real quickly. This is the form that you will fill out. So it's important to note that you have to fill out this claim form for any OHIP alternative claims. You do need to submit travel claims via claim form, as well as accident claims. You can also submit your dental and drug claims through this way as well. I'm going to show you how you can also submit online through an e-profile that also allows direct deposit into your account. This, you do need to make sure you put your current address because you will receive a check as your reimbursement. So it's pretty self-explanatory. It's also a fillable form. So all you need to do is fill it out online and then email it. You'll see here, it's email to claims@morecare.ca and just fill in the form, information about your claim. Let us know what the claim is for, how much, make sure that you are signing it. And you have to tell us if it's to be paid to the student or to the hospital. So if you paid out of pocket, and of course it would be paid to the student. And if you got an invoice from a hospital and they're waiting for money in return, then the payment would be to the hospital. All right, we're going along real quick here. So your student medical card, this is a card that you do need to make sure is with you. I recommend that you print it out 3-4 times, put one in your favorite pants pocket, put one in your wallet, put one in your backpack, put one in your purse, just so that you always have it. You can also get it on the MoreCare app. So we do have an app, which is just if you type in MoreCare, MoreCare, into, the App Store, it'll come up. It's a nice little blue tab, and you can get your card on there too. So you just put in your date of birth and your student number, and your card will generate. And that's what you bring with you to the doctor's office, the hospital, dental office, or the pharmacy. If we keep scrolling down here, we do have some discount networks, which is great. I want to highlight the dental discount network. So if you go to one of the discount network dentists, you actually save an additional 25%. So if you have 80% covered and you save an additional 25%, that's more than 100% coverage. So I definitely recommend checking this out, especially since you guys are George Brown students. There are so many locations in the Toronto or Greater Toronto area. So you just need to make sure that you go to whomever is actually the doctor that is specified. So here it would be Dr. Maria Ang, and that would be a dentist that would give you an extra 25% off. You just want to call ahead just to let them know that you are a MoreCare student, and they'll be able to put that through for you. All right, and finally, the provider map. So I do want to preface this by letting you know you are able to go to any doctor's office or hospital that you need to. So please do not take this as, oh, I'm not close to this, provider map hospital, I can't go to the hospital. That is not true. This is just a map that shows you what hospitals and doctors' offices are affiliated with us at MoreCare and WeSpeakStudent, and they will take your MoreCare card so you won't have to pay out of pocket. That being said, if it's an emergency, please go to your nearest, hospital, and then even if you do have to pay out of pocket, you'll just submit to get reimbursed. So your health is key. But of course, if you're looking for direct billing, these are wonderful options for you. You'll see here, Humber River Hospital is a direct billed. There's various life labs that are direct billed, as well as Apple Tree Medical Centers too. All right, we also have some coupons here at the bottom. My favorite one personally is the Shoppers Drug Mart coupon. You save 10% on prescriptions and Shoppers Drug Mart brands. So just have that coupon available for you, and that's a great extra savings. There's some additional tutorials down here, as well as a feedback form. So I know that's a lot of information. I have gone through your coverage details. I've gone through your forms. I have gone through how you submit the claims and also what you use your benefits card for. I'm just going to go back to the beginning page here. Remember, we were in this area here, the post-secondary plan. That's the area that we were in today. So before we get into questions, I'm just going to mention a couple things. So there was an option to add family or opt out, or I shouldn't say opt out, my apologies. There was an option for international students to add in family. Unfortunately, that is now closed. That is why it says that. That's what's behind there. You're going to also notice some other, useful pieces of information here. So how to submit your claims online. This is information on how to actually submit your claims online and if you have to fill in the form or not. So this is a really helpful piece of information. You'll see what claims need to be submitted by, it says mail only, but now it's also email only. We've allowed students to be able to email too. But you can also create an account. So you just have to register for an e-profile, and then you'll be able to submit your claims online and then get a direct deposit for your health and dental claims. So that's your dental claims, drugs, vision, extended health. So you're just going to want to click on the register now, go through the necessary steps, and then you'll be good to go. I know too, it is sometimes a little bit difficult knowing where do I go to the doctor. So I'm going to show you two wonderful options that are available to you. The first being calling our call center. So if you see here, this is our call center, and you can call us if you are looking for assistance in setting up an appointment with direct billing. So if you would give us a call, you can let them know, I'd like to go see a doctor in this area. They'll be able to set up an appointment. All you need to do is bring yourself and your MoreCare card, and there will be no additional costs to you. If you are looking at having a virtual appointment, this is something I highly recommend. And in my personal opinion, I think what we should do, especially with how the Ontario healthcare system is going right now with COVID-19 and not really wanting to be around other sick people if we can help it, please do use the virtual doctor's option. What that is, it's literally what it sounds like, a virtual doctor. So you will be able to speak with a doctor in real time through the website. So if you just click on the virtual doctors tab, it will bring you here. You just need to create an account, and then you'll be able to speak with the doctor at no additional cost to you. If the doctor thinks you should go see someone in person, they will let you know. They can also write prescriptions for you. They can, give you referrals if you need them. So I highly recommend, if you're unsure of where to go to a virtual doctor first, and they'll be able to help triage where you should go next. All right, last but not least, I do want to touch on Real Campus. So Real Campus is a student assistance program that is available to all George Brown students who are covered under the health plan. It is a short-term counseling service that is available, and it's in addition to your coverage that I just went over. So I'm just going to click on it, and I'm going to kind of just quickly go through their website. I highly recommend taking a look through this. I also want to, remind you that you might not need to speak to someone now, but 2020 has been a really difficult year, and we just want you to know that we are here to help in every way that we possibly can. So if you scroll down, you will see all this wonderful information, but I think the most important is how you can speak to a counselor. And that's right away. So call the number 1-877-390-REAL, and you can speak to a counselor. We also have a chat service that's available to you too. So you have quick access to therapy and counselors, the virtual doctors, which I already went over. There's various courses and webinars that will be available. It's multilingual, and it's confidential and private. So it's important to know that your information will never be shared with the school. There is never a time that, anything will be shared. This is entirely confidential and private. So if you keep going down, you'll see the therapy that's available to you. So there you can be working with clinical social workers as well as different counselors. So if you are looking for academic counseling or career, legal, nutritional, financial, this is an overall, your overall wellness. We want to help you with everything, and whatever might be stressing you, we're here to kind of help guide you through that. So you'll see here how to access it. So by phone, as I already said, you can call anytime. Email, which is, pretty easy. Live chat, as I said, they have a live chat, and instant care. So you can actually get on-demand access from 8 a.m. to 8 p.m. every day. And you can speak to a therapist, in immediate time as well. All right, so that was a lot of information, and I appreciate you all being so patient as we went through it. So I'm going to stop sharing my screen. I'm going to start reading through some of these questions, and we can answer anything that you guys might have questions with. So someone asked how they can get their medical card. I'm hoping that was a premature question, and I'm hoping that's now been answered, but it is on the website, as I said, and then you just got to click through the international portal, and then you just click on student medical card. Super easy, and you just get your card online. All right, someone could not hear me. I hope you could end up hearing me. I'm assuming it was probably just your audio. It says, does MoreCare cover any drug that we take from pharmacy for regular issues without doctor's visits? So what prescription means is a doctor has prescribed this drug. So if you're meaning, would they cover, painkillers that are over the counter, as we would call them? No, that's not covered. It would need to be prescribed by a doctor. But as long as it is prescribed by a doctor, then most likely it will be covered. Someone asked, is there any pet insurance in MoreCare? No, there is not. Someone asked, so student card is the same as OHIP card. No, it is not. So you have your student card with George Brown, and you also have a More Care card. It's also not an OHIP card. So I want to make sure that there isn't confusions here. It's a More Care card. An OHIP card is something that is separate. So if you're talking to someone, you do not have a More Care card. Sorry, you do not have an OHIP card. You have a More Care card, which is inclusive of the OHIP Alternative insurance, just so that everybody's clear there. But this is separate from your student card. So this is an entirely different card. So please make sure that you print this out too. Someone said, do you need to sign up for a new account in the website? So great news is that you are automatically enrolled in this plan, but you do need to create a profile for the e-profile claim submissions. So if you don't want to submit online, then you don't have to, but I highly recommend starting the e-profile. You do already have the coverage, so you creating that account won't be creating your coverage account. It'll just be creating your e-profile so you can submit claims. I am recording today, so I will send it to Yukiko at the SA, and I'm not too sure what she'll do with it, but we are recording it today, and I'm sure Yukiko will somehow share it so you guys can watch later. Good question. Someone said, do all pharmacies have More Care in their system, or do I have to pay them and then claim? Pharmacies, yes, pharmacies will be able to put your More Care claim through as long as you have your More Care card. Same goes for dental offices. It's just vision, you're going to have to pay out of pocket, as well as paramedical practitioners. So that's like massage, chiropractor, that kind of stuff. And then for the doctor's offices and hospitals, it's ultimately up to their discretion. It's up to their choice. So that's why I did show you the provider map. Those specific doctor's offices and hospitals do have a relationship with us where we know they will accept the More Care card. Some others might as well, but again, it is actually entirely up to their choice. Someone is asking a question about George Brown, because now I'm in my home country and I'm going to attend in my program. If you're having any program questions, I really recommend reaching out to the SA, and they can, help navigate you and where you can get those answers. All right, so that's all the questions that are in the chat. I'm not sure if anyone else has any other questions. If anyone wanted to unmute themselves and ask, then that would be no problem. Someone just asked pharmacy, I would have to pay 20%. Yes, but if you went to Shoppers Drug Mart, for example, they have the 10% discount. So then that way you'd only have to pay 10% because you'd have an extra 10% off.
Hi, Kimberly. This is Savi.
Hello. Hi.
I have two questions. So one of my questions was related to the pharmacy, right?
Yep.
So if I use the shopper's coupon, that means I need to walk with my More Care card.
Yeah, so you're gonna always have to show them your More Care card at the pharmacy, and then you can also just show them the coupon, and then they'll be able to put that through for you.
So would this also go for the flu shot at Shoppers?
No, that would be totally separate.
Okay. And for insurance,
yes,
loss of life, God forbid, right?
Yeah.
If your spouse isn't living in Canada, then you wouldn't be able to claim for it?
That would only be if you added dependents to your plan. So if you paid to have your dependents added, then that would be part of that. But also please keep in mind the life insurance. That's if again, God forbid, that were to be if it's a loss of life due to an accident.
Oh, okay. Thanks so much.
You're welcome. All right. Someone also asked if they can make an e-profile at any time. Yes, you can make it at literally any time. I'm also just going to share a email for you here. This is the email at George Brown, the essay. If you have any inquiries in regards to your programs, or if you're left with more questions today, feel free to send them an email. Also, feel free to reach out to our call center at WeSpeakStudent.com, and they'll be able to help you too. Okay, I'm going to take that as I think no one has more questions. I really appreciate you all, tuning in this afternoon, wherever we all might be in the world right now. But if you are in the Toronto area, it is 2:40. So hope you have a great rest of your afternoon and evening, and stay dry because it is definitely raining where I am. So stay well, everybody, and have a great day. Okay. Bye-bye.